News Channel 5 network and millions of conversations. This is one of millions of conversations.
Welcome to the Millions of Conversations show. I'm your host, Samar Ali. At Millions of Conversations, we are working hard to understand why there is a growing trust deficit in our country and what we can do about it, starting at the hyper-local level. Knowing that listening is a powerful skill that we possess as humans, we have been listening intensely over the past several years to understand why our neighbors are so frustrated with our current systems, including healthcare. As we are sitting right here in the capital of healthcare for the United States, as Nashville is not only known as Music City, but also is often referred to as Healthcare City, we are continuing to do a deep dive with experts who can help us understand why our American medical system feels broken to far too many of us, and what we can do about it at the individual and neighborly levels to begin to fix it. We've now heard from Drs. Rachel Thornton, Dr. Connie Graves, and Dr. Stacy Davis. Joining us today to help us unpack this further is Dr. Divya Shroff. Welcome. A seasoned physician executive who works at the intersection of technology, operations, and strategy. Because of her early work on integrating technology into the medical profession, she earned the nickname Dr. Blackberry earlier this century. That was her nickname. And Dr. Shroff has had integral leadership roles in the two largest healthcare systems in the United States, HCA Healthcare and Veterans Health Administration, both at the corporate and community level. She practiced as an internist before moving into executive roles focused on developing adult and children's health care service lines. Dr. Shroff most recently held the post of Chief Medical Officer for a decade at TriStar Centennial Medical Center, which is HCA's flagship teaching hospital here in Nashville. During her time in this position, she led the organization through the COVID pandemic. Dr. Shroff is currently the Physician Executive Advisor to HealthStream, an innovative software company that has been partnering with healthcare systems, payers, and groups for over 30 years to transform healthcare workforce management, which we want to learn more about here today, along with her keen focus on how to make American medicine easier for patients, particularly those living in the rural areas of our state of Tennessee. So we are here with you now, Dr. Shroff. Thank you for bearing with me with that introduction. I wanted to make sure that everybody had a chance to understand the wide range that you have worked across our American medical system. And I just have to ask you this one first question, and that is, what made you decide to leave the bedside, to leave from being a practicing physician and to enter into becoming an executive?
Well, when my first job out of residency, I went to DC to work for the Veterans Health Administration. I was teaching for Georgetown and George Washington University. And I will tell you, it was probably the most perfect job for somebody fresh out of training, because you're starting with this innocence of you want to do good, which I think all of us who go into healthcare have that belief system of. And being in DC, I started to see patients on, I would say, both ends of the spectrum. So I had generals who had served, in the highest levels, who would come, rightfully so, leverage their earned VA benefits and come get medical care for the things that they were eligible for, while they also still had care in other parts of private sector, as well as veterans who were completely dependent on the VA as their care. And as you started to get to know these patients, right? I'm an internist, I'm a quarterback, as I think one of your guests mentioned, which is actually, I believe in that analogy. I started to realize that there were things in the system that were broken that my individual patients weren't benefiting from. Okay. And so I was really lucky the VA was really keenly trying to think about how to support this well-deserved patient population and starting to recognize that technology was a place to do that. And so I, along with others, started to say, okay, how do we use technology as a way to actually improve lives? And I had a great mentor who said to me, you can either leave the bedside, you can stay at the bedside, and you are going to change a singular life every single day, and that is a very laudable role, or you could decide to leave the bedside knowing you're going to make impacts for many, but you may not have that personal experience.
Right. And have you missed it?
You know, no, because I think that guiding principle of that I am still trying to impact individual lives, it stuck with me, and I think I'm still practicing medicine just in a different way.
Right. So, you know, I mentioned that one of the things that you've been focused on is rural health. And I'd like to get into that a little bit more and to see from your perch and where you've sat, where you see rural communities needing to ask more questions. What do you wish sometimes they would ask more of and more about from you or people like you?
Well, as you mentioned, I was the Chief Medical Officer of Centennial Hospital.
Right.
And for those who may not know, that is the largest tri-star hospital in this region. And so the concept being that we are the hub and many of our other tri-star hospitals were the spokes. So as you start to get out into the suburbs or more further out, that's where you get your initial care. But if someone needs highly specialized care, from a cost dollar perspective, it doesn't make sense to have all those highly specialized services in those smaller hospitals. Because then you do have to think about healthcare as a business. And so does it make sense to spend the amount of dollars where you don't have that much patient per population?
So what might they have if they don't have, which specialists, what kind of doctors might
so
they
you
have?
want, at minimum, you want to have obviously a functioning emergency department.
Okay.
Right? Whether it's a critical access hospital or a smaller, you know, small bed, 100-bed hospital, whatever, you want to have a functioning emergency room. You want to have basic admitting privileges for both your adult and pediatric population to take care of those traditional things. Pneumonias, you know, various belly complaints. But when you start to get more complex, you need potentially higher level cancer care. That's when they get sent in. And what I found in my time as it's Centennial is I think we're starting to see a little bit of a triaging of what resources are in these communities. And a part of it's just the who's willing to work out there, what's available, what's the budget look like, and then that's creating a little bit, or not even a little bit, a fair bit of dissatisfaction because those in those communities don't know what they have or what they don't have. Something as simple as how many ambulances are serving your area. Right. So if you think about, we tell patients all the time, call 911 if you have an emergency, if you're having a heart attack, you're having a stroke. You know, those are those time-sensitive measures. So you need to get in. Well, how long is the wait for a 911 operator? How many ambulances do you have?
And have you seen that wait time increasing?
Yes, absolutely. And I think that we started to see a lot of that in the, you know, I think in the pandemic, but that we haven't seen that recovery in places you would. And so there are advances where I think, you know, all the health systems in Nashville are investing in more advanced helicopters to be that EMS. But again, how are you connected into those systems that you are going to get the care your loved one or you will get to a major city in time? Like, I don't know if everybody realizes that when you're living in those areas.
So you need to be asking questions around how many ambulances do you have? How fast are the 911 operators able to respond? And are they in communication and effectively with the hospitals that they're going to be sending their patients to, and is that information going to be relayed in time and in an efficient manner as possible?
Yeah, I think at a base level, right? Anybody who lives in a smaller community, what's your support structure? Are you dependent on a private structure? Are you dependent on public resources? What's the funding of that look like? Right.
Well, we're going to be getting ready to go for break, but when we come back, I want to talk a little bit more about who they should be asking these questions to. So thank you so much. Here with me is Dr. Shroff, and we'll be coming back right after the break. Welcome back to the Millions of Conversations show. I'm your host, Samar Ali, and joining me today is Dr. Divya Shroff. We were just talking about rural healthcare and the communications between rural communities and also TriStar Health facilities and other hospitals as well. One of the questions that came up for us is about do you know how many ambulances that are serving your local community? Do you know about your 911 dispatcher and what's the budget that's being allotted and allocated to them? Because a lot of times with time-sensitive matters, you need to be having those resources at your fingertips, is what I'm understanding. So how do people go about knowing what questions to ask, who to ask those questions to, and how can they influence the process here? That can be a life and death matter.
Yeah. I would openly say, you know, I'm obviously a physician who sees how a system operates.
Fair.
So what I would say, if it was me,
yes,
right,
of course,
you know,
as a patient
or a loved one, the things that I would want to know is, and where I would start, depending on how your county's made up. You know, as simple as, I still remember as a parent, I went to my fire station to learn how to make sure my car seats were installed properly. You know, if you think about most fire stations or more fire chiefs, they're somewhat involved in that EMS, emergency management system process.
Right.
It's as simple as that, or if you know who your mayor is or how your county is governed, just to understand, because by no means am I trying to take a position. My only point is I want people to be aware. Because I think, you know, in times of crisis, when you are in that need, when your loved one is being transferred somewhere else, then, you know, the systems are in place.
Right.
The ball's rolling, and either you're going to hopefully have a good outcome, hopefully you're going to not be frustrated. But if you have that preparatory component of understanding, it only leads to potentially a better outcome, even if the health outcome's not what you want, how you emotionally deal with that. And so I would say there are simple questions I would think to ask. You know, I grew up in a small suburb where going to the local mayor's office, like, hey, how do we work? What is our hospital structure like? Are we partnered with a major healthcare system in one of the major metropolitan cities, Nashville or Memphis or Chattanooga? You know, what does the transfer center process look like? Is it an automatic? Do we get to decide? Because I think when you're in these rural communities, there's also the expense or the strain of where does your loved one get transferred to if that's what's indicated? How do you manage?
And they might not be familiar with where they're being transferred to either.
Exactly.
And understanding even like small things like where to park.
Exactly. Right. And so I think some of that onus is definitely on the healthcare systems, on who they support and partner with in these rural communities. But again, that may not be known because if they're not per se owned by TriStar or Ascension or Vanderbilt, then there's sometimes arrangements that are made, or in fairness to some of these communities, and I personally experienced this, they're just calling to say, hey, I need a lifeline. And whoever's got a bed available, can you help me out?
So do we have a communication breakdown here going on?
I think yes and no. I think healthcare systems, I can say proudly, are trying to think about how they can support their communities, even into the periphery. But how much does the lay consumer know that? How much is shared on the front end to create a better proactive relationship? Or is there enough of a demand? You know, not a demand. Is there enough supply to meet the demand in the time, right? I think those are the times where then you realize we do have a communication breakdown, or more importantly, we have a system breakdown.
Right. So how do we fix that system? And where, is there a role for technology to play there?
Yes, I think there's an absolute role of technology. I think technology has goods and bads, right? We want the human factor, but we want to also capture the efficiency. So I think when you look at the specifics of transfer centers, and you know, how do we look at like data of at flu season time, we know that that's a time we need to increase capacity. We need to make sure there are more lines available versus other times. You know, you can use technology of just even looking at data. You could potentially, I say this, look at AI in ways to maybe streamline some of the phone calls. You know, there are things like that. You mentioned a company that I'm supporting, HealthStream. Their stance is, how do we use technology on ensuring that those whether in a rural community or in a major metropolitan area, they've got the education and it's delivered in a way that's digestible, that somebody knows what to do in those situations. So I think technology can be a helpful way of distributing information, of looking at themes and trends.
Can you share with us a story of when you felt like the communication has been flowing really well between the transfer center and another place? And can you give us an example of when it hasn't and what you wished you would have had in that instance?
So I've seen great examples of where a healthcare system will look at and say, how many beds do we have in a market? Where do we look at, are we triaging the right patient to the right bed in a really seamless fashion? Now, in that example, that works out great because hopefully from a global perspective, that administrator, you're able to serve more people. The one caveat of that is, back to your question about communication, is how are we letting those individuals know that maybe they didn't get to the hospital of choice? Them know? Yes, I mean, and that's a part of it, whether it's the referring facility, whether it's the incoming facility, of explaining that. And then how do we, maybe on even a bigger scale, how are we educating our community that, like, we're trying to service a lot of people? So while you didn't get your first option, it's so that we can take care of more.
And who's making that decision?
You know, it really depends on the healthcare system. Have they invested sometimes in the technology or the thought process of how do they triage beds? I mean, so it's really about that.
What does it mean to triage a bed?
So I have many a times been on call with a transfer center. You know, that's one of the things you have to do as a leader. And in that moment, if your relationship with the transfer center is saying, okay.
What's a transfer center?
Sorry. I should have said that. So a transfer center is almost like an internal, not 911, but an internal bed resource management, where they would say, okay, we know what Centennial has capability of versus Skyline versus Summit. When they get
and is that connected to 911 or is that separate?
Totally separate. That's more at a facility level once you're in the emergency room of one of these rural hospitals, where they would then say, you know what, I have somebody that I don't have the ability to care for here. I need to get them to a higher level of care. For whatever reason, they have a condition that we can't take care of, we don't have the resources, we may not even have the type of imaging system, a CAT scanner, whatever it may be. When they're getting transferred, a lot of time these physicians or advanced practitioners, they're just calling to say, do you have a bed to take care of my patient, knowing the clock has started in their medical condition and they want to get them that care.
I see.
And depending on who they're calling, if they've either created the processes, because technology is just a way of improving processes. If they have thought through to say, well, look, you've told me this patient has X conditions, you don't have the capability for it, absolutely, we will get them a bed, but we're going to get them a bed here because I want to preserve a bed maybe at a more complex facility for someone who needs bypass surgery.
I see.
You know, things like that. But there's a lot of thought and intention that needs to go into how
so
are you.
That triage center that's connecting the patient in the rural area, let's say, or the suburb, with a major hospital that has the ability to take care of them, there is a third-party facilitator that's matching them? Is that correct?
Yeah, and but usually that third party traditionally is by those larger healthcare systems. It's their own employees, where you want them to work with someone like myself or other chief medical officers to say, hey, let's look across the board. What are the capabilities? What's the best resource utilization management?
So one of the ways you're looking to do is to figure out how to make that even more efficient. And technology can help make that more efficient. And so you're looking for technological solutions as well. And AI can help potentially do that. And one of the things that you want to make sure that I'm hearing you say is that the patient gets communicated in real time what they need to know, and sometimes that's a human condition that sometimes is not as smooth as it could be, that maybe we need to pay some more attention to.
Exactly. I think, and a big part of this, I will say, the concept of transfer centers are not new. I trained to become a doctor in the late 90s. And when I trained in St. Louis, similar thing, major metropolitan city, but you're now supporting, you know, out to the outskirts of Missouri, but also across into Illinois. And when patients would come in, you know, how much are they understanding from in that relationship with their rural community of what the expectations are?
And as somebody who worked as a CMO during COVID, Chief Medical Officer, and this is going to be our last question, what was that like for you? And did you feel like we were ready for that moment?
I think we were as ready as we could be. I think because this was a disease that we knew so little about, we learned as we went, and we did improve. And I'm really proud of, I would say, the collaboration that myself and the other chief medical officers of the major systems, Vanderbilt, Ascension, and centennial, how we work together to support our Middle Tennessee community. I hope we never have to do that again, but I also hope that if there is something like that again, we leverage the lessons learned and are even better next time.
Well, thank you so much, and thank you for giving us hope, and it has been a real pleasure learning from you. Thank you. Welcome back to the Millions of Conversations show. I'm your host, Samar Ali. If you've been tuning in and listening as I have, you'll know that Dr. Shroff has given us the following 3 key homework assignments that we need to be doing together if we want to help heal a growing trust gap that we're experiencing here between patients and American medicine. Number one of the key things to do is to think about what is the financial health of your local hospital look like. Ask questions about that. Number 2, know how many ambulances are accessible in your community. Is that enough? Is it following best practices? Do you need more? Do you need a bigger budget for your 911 dispatcher? If so, ask those questions to your local government authority, whether it be the mayor, whether it be the county commissioner. Find out who to ask. And third, look into and seeing who is your local healthcare facility partnered with. Who might they have a partnership with that's a larger hospital? Know how to get to that larger hospital, know what questions to ask of them as well, and ask and see if they have a community board. Many of these large hospitals also have community boards where they ask for local rural community members to be on those boards so that we improve that communication flow that is so critical to making sure that we better that relationship between healthcare providers and us as the patients. Many times time is of the essence in these instances, and communication is key to that. Let us work together in bettering how we are in community together. It starts with listening. Thank you.